Hello students, this is Dr. Nidhi Gupta. I am a faculty at Center for Population Health and Development, School of Development Studies at Tata Institute of Social Sciences, Mumbai. I welcome you to the module on reproductive tract infections, types, causes, prevalence and prevention. At the end of this module, you will have an understanding about the type of reproductive tract infections, their causes and prevalence. The module will also enable you to understand the measurements and prevention of different types of reproductive tract infections and consequences of untreated RTIs, their sequelae and complications. The module will also familiarize you with the linkages between RTIs and key health related development programs. Reproductive tract infections or RTIs are infections of the genital tract which affect both men and women. RTIs is a generic term used to cover three types of infections, which includes sexually transmitted infections like syphilis and gonorrhea, endogenous vaginal infections, and infections related to reproductive tract. Reproductive health, when viewed from a rights perspective, lays emphasis on sexual health, which should improve the personal relationship to ensure an individual free from reproductive tract infections and sexually transmitted diseases. The burden of untreated RTIs is especially heavy for women because these infections are often asymptomatic or the symptoms are not recognizable. Morbidity and mortality related to RTIs deprive the society of important contributions made by women in terms of economic, social and cultural development. Although RTIs affect women in both developing and industrialized countries, the infections and their sequelae are an especially urgent public health problem in developing countries around the world. Demographic changes in developing countries have led to a dramatic increase in the number of adolescent and young adult women and men in their most sexually active years, which translate into greater proportion of the population at risk for RTIs. The problems associated with reproductive tract infections have become even more significant in the past decade with the emergence of HIV and AIDS. Now let us look at some of the most commonly occurring RTIs in developing countries. Some of the more common bacterial infections occurring in developing countries include gonorrhea, chlamydia, syphilis, bacterial vaginosis, chancroid, etc. If you look at the protozoal infections, Trichomonas is the most commonly occurring infection in developing countries. Among viral infections, most common in developing countries include HPV, that is the human papillomavirus, hepatitis B virus, herpes genitalis, herpes simplex virus and HIV. Now let us look at the factors that affect the spread of RTIs in a population. There are various biological, behavioral, healthcare and socioeconomic factors that determine the spread of RTIs in a population. Some of the biological factors highlighted by various studies include duration of infectivity, presence of other STDs, infectivity of particular strain of the pathogen, age and presence of cervical erosion, immunologic status and circumcision status. There are various behavioral factors which also play a role in the spread of RTIs in a population, which include rate of sexual partner change, type of sexual intercourse, anal, oral or vaginal, use of condoms and other contraceptives, patterns of sexual contact and mixing. Some of the healthcare factors include access to quality healthcare facilities, access to laboratories, facilities, and availability of appropriate treatment. There are various contextual factors also, like the socioeconomic factors that determine the spread of RTIs, which include the migration patterns, the ease of travel, level of education, religion, civic unrest, and position of women in the society. Now let us look at the types and causes of RTIs. RTIs is a generic term which is used to cover three common types of infections, first being the sexually transmitted diseases, now called as sexually transmitted infections, endogenous vaginal infections, and iatrogenic infections. RTIs may affect the upper reproductive tract, that is the uterus, fallopian tubes, or the ovaries, or the lower reproductive tract, that is the cervix, vagina, and vulva, or both upper and lower reproductive tracts. Now let us look at the types of reproductive tract infections. As we already saw that there are three types of RTIs, that is STIs, endogenous infection, and iatrogenic infections. Now let us look at each one of them in detail. The sexually transmitted infections spread from one infected person to another through sexual intercourse. Some infections may also be transmitted from mother to child during pregnancy and childbirth. Another way that these infections are passed on to the other is through sharing of blood products or tissue transfer. Some diseases caused by STIs include syphilis, AIDS, and cervical cancers. STIs such as syphilis, gonorrhea, and chancroid spread more rapidly in places where communities are disruptive, migrant labor is common, and commercial sex networks are active. Endogenous infections. The normal vaginal flora of healthy women of childbearing age is dominated by lactobacilli. However, in the case of endogenous infections, an overgrowth of other organisms occurs that alters the pH of the vagina, hence consequently provides a suitable ecology for growth of other bacteria and fungi that causes various types of infections. Endogenous infections are common worldwide and are influenced by environmental, hygienic, hormonal, and various other factors. Now let us look at some of the endogenous infections like candidiasis. Candidiasis is caused by an overgrowth of the fungus known as candida, which often results due to recent use of antibiotics, vaginal douching, use of progesterone containing oral contraceptive, or immune suppression. Symptoms of candidiasis include thick, curd-like discharge, vulvovaginal inflammation, and painful sexual intercourse. Bacterial vaginosis is another endogenous infection that also occurs due to an imbalance of the normal vaginal ecology and often results in an increase in the vaginal pH. Among women with bacterial vaginosis, the normal dominant lactobacilli are replaced by another type of gram-negative Rhodes bacteria. Some of the symptoms include a homogeneous discharge and vaginal infection may be present, but bacterial vaginosis often remains asymptomatic. Bacterial vaginosis occurs in association with intrauterine device use and the use of vaginal drying or tightening agents. Worldwide, endogenous infections are the most common cause of reproductive tract infections among women. Many women believe that the symptoms caused by vaginal infections are normal and part of female experience and consequently do not seek care. These infections can be treated with oral antimicrobial or topical intravaginal creams. If not treated, endogenous infections have the potential to cause severe complications such as premature rupture of the membranes and premature birth during pregnancy. Untreated bacterial vaginosis can lead to pelvic inflammatory diseases, and there is sufficient empirical evidence of its association with increased heterosexual and perinatal transmission of HIV. Now let us look at what is iatrogenic reproductive tract infections. Iatrogenic reproductive tract infections are the result of bacteria being introduced into the normally sterile environment of the upper reproductive tract through medical procedures such as the insertion of intrauterine device, induced abortion, or during delivery. Unsafe abortions are a particularly common cause of iatrogenic infections. Iatrogenic infections are common where there are many STIs and where healthcare professionals do not have the training or supplies to perform these procedures safely. According to the World Health Organization estimates, 20 million unsafe abortions take place every year, of which the vast majority takes place in developing countries. Complications occur after 10 to 50% of unsafe abortions. Iatrogenic infections can involve the uterus, endometrium, fallopian tubes, and ovaries, and can therefore result in very serious consequences if not treated timely. However, most of these infections can be successfully treated using antibiotics on timely diagnosis. In men, sexually transmitted infections are much more common than endogenous or iatrogenic infections. However, among women, non-sexually transmitted RTIs are usually common. RTIs appear to pose a much greater problem in pregnant adolescents than in older pregnant women, who are more likely to be involved in a stable monogamous relationship at the time of conception. Now let us look at the prevalence of various RTIs. The epidemiological data shows that incidence and prevalence of various RTIs vary greatly between countries and even between regions within a country. A reflection of these differences in the characteristics of each pathogen, such as the duration of infectivity and transmissibility, as well as other biological, behavioral, medical, social, and economic factors. Among pregnant women in developing countries, it is estimated that gonorrhea rates are 10 to 15 times higher, chlamydia rates are 2 to 3 times higher, and syphilis rates are 10 to 100 times higher than the rates of these STIs among women in the developed countries. Rates of RTIs tend to be highest among high-risk groups such as commercial sex workers and clients of STD clinics, but are also prevalent in asymptomatic populations and low-risk women such as those attending the antenatal care clinics. In Indian community-based studies, the range of self-reported morbidity has been reported to vary from 39 to 84%. Now let us look at the complications and sequelae of reproductive tract infections and HIV. Untreated RTIs are among one of the major causes of infertility among women and sometimes men, as they may lead to inflammatory diseases of reproductive tract that may block the reproductive tracts like the fallopian tubes in women and vas deferens in men. Each year, thousands of women die from sequelae of undiagnosed or untreated RTIs, including cervical cancers, ectopic pregnancies, acute and chronic infections of uterus and fallopian tubes, and puerperal infections. Other sequelae include infertility, fetal wastage, low birth weight, infant blindness, neonatal pneumonia, and mental retardation. Pelvic inflammatory diseases are one of the most serious consequences of RTIs in women, which occurs when an infection of the lower genital tract, that is, either from cervix or vagina or outside organisms, reach the upper tract, that is, the uterus, fallopian tubes, ovaries, and the surrounding structures. The infection may become generalized and life-threatening, and resulting tissue damage and scarring may cause infertility, chronic pelvic pain, and increased risk of ectopic pregnancy. The tubal scarring and blockage that often follow a pelvic inflammatory disease may be total or partial. Fertilization can still occur with partial tubal blockage, but risk of implantation in the fallopian tubes and other sites outside the uterus, which is called ectopic pregnancy, is high. Certain types of human papillomavirus, that is HPV, are associated with the development of cervical neoplasias. Chronic pain may be experienced by patients with RTIs such as genital herpes and pelvic inflammatory diseases, which may cause persistent or episodic genital or abdominal pain. Over the course of HIV infections, potentially the most serious RTI, the spectrum of symptoms may occur, which include acute retroviral illness, sore throat, swollen lymph nodes, increased skin rashes, herpes zoster, pulmonary tuberculosis, diarrhea, chronic fever, severe weight loss, bacterial pneumonia, debilitating fatigue, and various other infections, recurrent infections, and untimely death. Now let us see what can be done to prevent RTIs and their complications. Some of the key strategies to control RTIs in resource-constrained settings are as follows. Improving the awareness of community level about safe sex to control STIs and awareness about the signs and symptoms of reproductive tract infections is the most important strategy. Behavior change communication to improve health-seeking behavior for RTIs among individuals and communities. Improving the skills of healthcare practitioners to promote accurate diagnosis. Timely and right treatment, hence access to quality healthcare for right treatment including diagnostics and medicines should be made available. Complete treatment, awareness about importance of treatment completion to avoid complications and reproductive morbidity should be improved among healthcare practitioners as well as patients suffering from RTIs. Some of the intervention strategies for RTI control should focus on overcoming the various challenges. Poverty and labor migration separate families and lead to risky sexual behavior. Low status of women that limits economic options and leads to risky sexual behavior. Women may exchange sex for money or other forms of support. Low status also means little control over decisions and less ability to negotiate with partner. Poor healthcare services have little to offer for prevention and care of STIs and RTIs. People do not have easy access to healthcare facilities. People do not use healthcare facilities. These are some of the challenges that should be borne in mind while designing the interventions, especially in resource-constrained environments of developing countries. Now let us look at the linkages between RTIs, their Sequelae and Key Health-related development programs. A major challenge facing women with RTIs in developing countries is limited access to healthcare for those infections. A considerable amount of treatment for RTIs is offered by pharmacists, traditional healers, untrained laypeople, and street vendors. Concept of case management used in developed countries are usually not appropriate for implementation in developing countries in which care is provided through an array of services and individuals. Hence, prevention and treatment services for RTIs has been integrated into other reproductive health services routinely attended by women, including family planning and prenatal clinics under the Reproductive and Child Health Program of India. RTIs are an integral part of fundamental health-related development programs such as these concerning with family planning, child survival, women's health, safe motherhood, and HIV prevention. Hence, to conclude, we can say that not all sexually transmitted infections are reproductive tract infections and not all RTIs are sexually transmitted. STIs refers to the way of transmission, whereas RTIs refers to the site where the infections develop. Reproductive tract infection is a broad term that includes sexually transmitted infections as well as other infections of the reproductive tract that are not transmitted through sexual intercourse. RTIs are caused by a variety of bacterial, viral, parasitic, and fungal microorganisms which have major consequences that may lead to infertility to enhanced transmission of HIV. The prevalence of RTIs not only causes symptoms like pain and morbid conditions in the reproductive system, but it also contributes to infertility, ectopic pregnancy, recurrent infection, genital neoplasias, and enhanced transmission of HIV and chronic pain. These often lead to marital discord and social exclusion, especially in developing countries. RTIs are preventable and many are treatable as well. In men, STIs are much more common than endogenous or iatrogenic infections, and among women, non-STIs are usually more common. Reproductive tract infection continues to be the major and growing public health issue in many parts of the world and are particularly widespread in resource-poor settings. Without early diagnosis and appropriate therapy, complications of RTIs severely compromise women's health, fertility and productivity, infant health and their survival, and effectiveness of family planning programs. Interventions that truly decrease the burden of RTIs will involve the coordination of efforts among several interrelated health initiatives and will include changes in the outlook, knowledge, skills and resources at all levels of the healthcare system. Thank you.